So the community health promoters are community members. And why we use community members is because of the understanding of the local dynamics, either cultural, socio-economic, and other dynamics, which as the health professionals we may not have an understanding of. So we know that majority of the people are at home, they don't stay in hospitals, and therefore we need somebody at home who has been trained, because we have trained them, to be able to understand just key messages around different health issues, and they can be able to continuously tell their fellow neighbors about these health messages so that we can improve overall knowledge and health in the community. And when they go to the facility, the professional health worker is now able to give much more information. But at that level, we need our people to be knowledgeable, not to be ignorant, and we need the fellow community members who understand their language, can explain things in their language, to be able to do that work. So they are not health professionals, but the ministry has trained them on the basic issues around health promotion, how to eat healthy, how to wash your hands, how to have proper latrines or a toilet which is clean to prevent some of the diseases that we have, like diarrhea and so forth, how to clear your bushes so that you don't get malaria. So those are the basic things that we train them to do, and then they are able to go back to their communities and continuously train other people. And basically they are not health workers, but they have training to do those simple, basic health education as a community.
So how does one help, or maybe attend to someone who maybe is asthmatic and they need to give, first aid? How do they do that if they're not trained, if they're not professional?
So for that, since they are able to always be in the household, they've also been taught how to identify some danger signs and refer those people immediately to the facility. A lot of times people stay in their home, they are sick, but they are continuing to stay at home without any intervention. But now these people will come, they will tell you, the way you are breathing right now, we have been told you need to go and see a doctor immediately. Don't go to the chemist to buy some Panadol or whatever. Go to the doctor immediately.
But we have some of them who are professionals, some.
So at that level, we have what we call a supervisor, who is a community health professional, has been in KMTC and has been trained on community health. So they are supervising a group of 10. So for immediate support, they can go there. But the work of these community members is to refer immediately, and also they can be able to do some basic first aid as well. Yes. So one of the other reforms beyond just putting them on board is that you know that we are having the 4 bills that are being signed into law, and some of that bill, one of those bills, the social health insurance bill, has what we call the primary health care fund. So the primary health care fund will be a fund that will be supporting the work of primary health care, which starts at the community, at the dispensary, and at the health center. So that's how we hope we will bring resources or the funds that are required to ensure the program is sustainable in the long term.
How many of them are employed or you're aiming to employ across the country?
As I said, we currently have, we are supporting 100,000 currently, yes.
But you are aiming at?
Well, let me not talk at what we are aiming, but we are hoping maybe the entire population should be covered by about 110,000 community health promoters.